Welcome and good morning, everyone. Thank you first to all the faculty, staff, and students for the planning that got us to this point. I want to thank also all of you for your understanding and flexibility as we figure out the remaining decisions and implementation points as we discuss our fall reopening. We know you have a lot of questions and that uncertainty is very stressful at times. Today, our goal is to share what we know now about current decisions and our implementation plans. More communication is going to continue as we prepare for the fall. We'll have FAQs, we'll have campus communications, we'll have student town halls, and there'll be additional meetings as needed. Our format today is to be scheduled to go for an hour. We'll spend the majority of our time addressing your questions with brief introductory comments from me. In advance of today's town hall, we received 100 questions, and we're going to continue to receive them throughout the town hall. And every one of those questions will be answered either in the town hall today or in terms of FAQs as we have our fall 2020 reopening website that has been launched. As we plan for resuming our campus operations, our students and your health and safety have been our top priority. We know that in this COVID world, there are no guarantees of 100% safe environments, but we have planned with a very deliberate focus on actions that will provide safety and health to the extent feasible during a pandemic. There are many safety precautions and actions that we've taken that include requiring face masks, particularly inside buildings, maintaining social distance, encouraging frequent hand washing, identifying paths for ingress and egress through classrooms and other shared spaces, installing plexiglass in offices and classrooms where requested, limiting residence and dining hall occupancy, supplying PPE and sanitation materials, increasing cleaning and sanitation of classrooms and other facilities. We have also been developing Panther health and safety standards of care for self, others, and community, such as monitoring temperature and symptoms, self-isolation, communication with supervisor, and other protocols, and then other activities that we will be continuing to share and communicate. Our future success and will be directly related to everyone on campus following and supporting these health and safety standards and expectations. The primary rationale for resuming our campus operations is embedded in our mission to provide access to education, to conduct research, and to engage meaningfully. It's very difficult to do those things from afar, as we've seen over the last several months. Our goal is to resume fuller operations in the future, and we can only do that if we start operating at a percentage of our face-to-face operations and build upon that safely over time. Planning in this COVID world is complex and dynamic, as you know. We know a lot more than we knew a month and 2 months ago, and we're going to know more in a month and certainly after the fall semester begins. But our overarching philosophy is that we want our employees and our students to be able to work together to provide essential services for our students, for research and engagements in safe ways, including following CDC and other public health authorities' guidance. For some, this means working on campus with reasonable safety accommodations. For others, this means working from home. Please note that this will vary by role and needs over time. To the extent possible, we will try to accommodate your individual preferences and circumstances, including instructors' preferences to be discussed with their department chair or program director. We're working on specific guidelines and protocols for all appointment types that you can discuss with your supervisor, department chair, and HR prep. Finally, before handing the floor over to Provost Britz and his team, I want to acknowledge the fear and anxiety associated with COVID-19. While many of you have shared with me how you look forward to getting back to the classroom and students, offices, and labs, others have expressed legitimate concerns about yourself, your family members, students, and others. The uncertainties will be reduced, we hope, as we work through the issues and prepare for this coming academic year. I am very inspired by your energy and desire to resume, and that of our students and community wishing us success. So the order of topics and panelists today will include class formats and teaching issues that will be led by Provost Britz and a team of panelists, student issues, which will be led by our Chief Student Officer, Kelly Haig, and a team. We will have mask testing and physical distancing, which will be led by our Campus Health Officer, Dr. Julie Bonner, and team. And then Vice Chancellor Van Harpen will cover facilities, parking and transportation, and working from home with her team. Provost Britz, please take it away.
Thank you very much, Chancellor Mone, and good morning, everybody. I have with me Dean Scott Grinner and Diane Reddy, who's the Director for the Center for Excellence in Teaching and Learning with me this morning. And Scott, as you know, who led our scenario planning work group, will talk a little bit more about process and timelines. And I asked Diane to also talk a little bit about the support of CETL and hybrid instruction, as well as quality control of online instruction. As an introduction, I just have 3 core comments that I would like to make, and then I'm going to ask Scott to continue the discussion based on your questions. My first comment relates to our scenario planning for the fall semester. I hope I have still a video. Is that for the fall instruction, we will allow, and that will include face-to-face instruction, but of course, due to the health and the safety and classroom constraints, we will still be mainly online. And as for our full face-to-face instruction, we do recommend a hybrid approach because it will simply allow us to utilize more classroom space for our face-to-face instruction. My second comment relates to the academic calendar. We will not alter the calendar. We will utilize the full academic calendar, but also we are planning, should it needed to be, that we can actually revert very quickly to a fully online, should there be a spike with the coronavirus. My third comment just relates to the timeline. As we speak, we are now working with the schools and colleges on identifying those courses that we want to teach face-to-face, and as well as classroom assignment with the Office of the Registrar. And with these few comments, I'm going to give it over to Scott to talk through the timeline in more details, as well as the process. Scott, over to you.
Well, thanks, Provost Britz, and good morning, everyone. We had lots of questions, you might as imagine, about the fall teaching and the schedule, and I'm going to try to bundle those questions together as best as I can in these answers. As Provost Britz said, we're not changing the academic calendar. Aside from asking instructors who have courses with key experiential learning components to try to finish those before Thanksgiving in case the campus needs to revert to online teaching after Thanksgiving. For students also, a key part of this was not to be changing schedules after students had signed up for classes. So there's no significant changes in the student schedules as we go through this process. Lots of questions about timeline. I know everyone wants to know as soon as possible what's going on with their courses in the fall. We're looking at roughly mid-July to be able to have the schedule of classes finalized. That will have the modality of the course, that's face-to-face or online. It will also have the classroom assignment. And I'm going to talk a little bit about the process that we're going through to try to get those classrooms assigned and why it's very hard. At this point, as Provost Britz mentioned, the units are doing final updates on their priorities for face-to-face instruction. We asked the units to do that earlier, and now we're getting last-minute changes that we're going to implement. Why is this so hard? Well, we want to do this in a safe way. We're using CDC guidelines for social distancing, and what that does is makes our classroom capacity drop by a large amount. Most classrooms will become about 1/4 their normal capacity, some even more than that. So lecture halls that normally seat 450 might have a capacity of less than 50. And so what that did is that all of our classroom assignments don't work. The rooms are too small for the courses. And so what we're having to do is try to reschedule classes into classrooms with only about 25% or less of our normal capacity. And that's hard. And that's what the registrar office is going to be doing in conjunction with our units. Again, I mentioned our units are working with their faculty to see what they want face-to-face. For the students, the good news is that they're not going to see any big changes other than when they look at the schedule of classes, maybe new classrooms, they may see a course is moved online, they may see a course is moved hybrid. We have special processes for looking at our labs and studios. Those are really important places to have face-to-face learning, and we have to have special ways of working that out. Lots of questions about what it's going to look like in the fall. Campus will have a different feel, certainly with fewer students on campus at any given time. All classes with over 100 are going to be online. 50 to 100 could potentially be face-to-face using one of our hybrids teaching methods, but because of the limit on our number of large rooms, or rooms with large capacity, there won't be so many of those. Courses with less than 50, that's where most of our courses normally are. Here we're going to see a mix of face-to-face, online, and the hybrids. What's going to drive that mix to a great extent, again, are constraints on our room capacities from social distancing. There's also a lot of questions about the hybrids, and we're suggesting two different hybrids that both rely on classes meeting 1 day a week and then doing the rest of the content online. And details about those hybrids have been provided to the deans. The reason why we're suggesting these is really twofold. One, it's very good pedagogy. And two, by doing so, it gives us more classroom capacity, which allows more opportunities for units to offer face-to-face where they want to do it. So that's the reason behind the hybrid. And finally, courses may come in mixed modalities. For example, a student may have a course that has a lecture, a discussion, and a lab. If it's a large lecture, it's going to be online, but the discussion and the lab could very well be face-to-face. So again, we're going to be seeing a lot of mixes between online and face-to-face instruction. The key driver in all of this has been to try to disrupt students' lives as little as possible, and we offer choice and quality to the students. And speaking about the quality of instruction, I'm now going to pass this over to Diane Reddy, the leader of our Center for Excellence in Teaching and Learning.
Good morning, everyone. CETL has developed a variety of new workshops and resources to help you prepare your fall courses. If you'll be, for example, using a hybrid or a blended instructional approach, where half of the students participate face-to-face one day and the other half participate face-to-face another day, and the remaining portion of the course is completed online by all students, you'll need to determine what would be best delivered face-to-face and what would be best delivered asynchronously online. And CETL can help you make this determination. And on the CETL website, you'll find a resource with suggestions for what you might deliver asynchronously online. Additionally, on the CETL website, you can access our self-paced online and blended teaching program, which will include next week a new module on teaching blended and flipped courses, and a new module on teaching large enrollment courses. Starting on July 15th, we will also have 1-hour webinars on teaching blended and flipped courses and teaching large enrollment courses online. CETL also started a new Canvas workshop series that is richer and more intensive than its predecessor on how to effectively use the tools in Canvas. We have an evaluation checklist for online teaching that's also on the CETL website. This will help ensure quality in online and blended teaching. CETL staff will use this evaluation checklist to evaluate courses. We've equipped schools and colleges. We want to equip them with this evaluation checklist too. And CETL can do workshops in schools, colleges, and departments on the use of this self-evaluation instrument. for online quality. And instructors can also use this evaluation checklist as a guide to quality standards in online and blended courses. So CETL staff are happy to consult with you as you prepare for the fall. Anything that you need, we're happy to try to provide that. At this point, I'll turn it back to Chancellor Mone.
Jay, I think you need to shift it back over. Okay, so thank you both Dean Grunert as well as Professor Reddy. I think that as I counted, you answered about 37 of the questions, so we've got a good start on things. At this point, I will transition over to our Chief Student Affairs Officer, Kelly Haig, who will talk about student issues. Kelly, please.
Good morning. As we know, the UWM student experience integrates students' experiences inside and outside the classroom. We'll continue to provide many of the online support services and virtual programming that we deployed in the spring of 2020, while working to expand our in-person offerings where possible, adhering to state and local public health guidelines. We remain committed to creating spaces for students to connect with one another and to get involved in experiences such as internships, service learning, and others that enhance their educational experience, but don't expect that we'll be able to create the large, densely crowded gatherings and events of previous fall semesters. As we've heard, students will be expected to wear face masks on campus except in their residence hall rooms, and to follow state and local public health guidance when off campus. We did receive some questions about a few campus services that impact both our students and our faculty and staff, and I'd like to touch on them here because I think it highlights the planning that's underway to balance access and health considerations, which will depend on the local public health guidelines applicable at the time. First, the UWM Children's Learning Center is currently closed. We hope to reopen the center in the month of August, but must account for several different planning scenarios before a reopen date is determined. Our intention is to reopen the center with a limited capacity and increase enrollment in phases. Another question pertains to the Hvac Center, which we know is a space where students, faculty, and staff often interact together. We're currently considering facility capacity, one-way walking paths, equipment spacing, proper cleaning, and program modifications. I know many of you participated in our virtual recreation classes over the spring. Our goal is to make a final decision about fall 2020 operations by mid-July. Finally, we have a question from Ellen Jacob, who asked about what specific measures we're taking to mitigate risk in the student union, which typically would see upwards of 20,000 visitors a day. The student union will be open to students, faculty, and staff as the fall semester begins. Priority will be placed on maintaining those services that are most important to students and the administrative staff that work within the union. Some union services, including some food service locations, will need to remain closed. Public spaces will be set up to promote social distancing. Campus events, programs, meetings, and other events hosted in the union will need to follow campus guidelines for capacity limits, and social distancing will be maintained in how the rooms are set up. As I mentioned before, many of the traditional large events that are hosted within the student union will need to be modified or not occur in the fall. Finally, there was a question submitted about tuition and fee structure in the fall. Because we expect some modifications to the services that we'll be providing to the students, and that will also need to provide additional support for online teaching and learning, the distance education fee and segregated fees, which will be applied to all students, will need to be adjusted. Those final charges are being determined as we speak, and we will be able to share those final numbers with faculty, staff, and students within the next several weeks. We do expect that those fees will be lower than in previous years, and there won't be any change to tuition. Now, because we know that living on campus is a large part of many students' experiences, I want to turn it over to our Director of Housing, Arcetta Knauts.
Thanks, Kelly. So good morning. Before I get into the details of some of the parts of living on campus, I did want to address a question that's come up a couple of times related to a second wave. So I'd like to assure students and their families that, as in the spring 2020 semester, students that were without housing options will be allowed to remain in the halls, although their room assignment may be modified. So I did want to touch on that before getting into some specifics. So for the housing plan for fall, student housing assignments will be made largely as they have in the past, with single and double rooms. We will assign 3 to 4 students in our Sandburg buildings, 2 to 3 students in our Cambridge Common Standards, and our upgrades up to 4. Kenilworth Square apartments and Piern Hall will be assigned as normal due to the apartment style living arrangement. We are implementing best practices with social distancing and sanitation. Steps include plexiglass guards at our major locations, PPE supplies like hand sanitizer and masks, as well as social distance markers. Our goal is to have assignments released the afternoon of Friday, July 17th, so I know families will be excited to know that. And for students, once you are assigned, you will receive an email that will notify you that your assignment has been posted to my housing account for your review. Cleaning specifically to university housing locations. So as I mentioned before, we'll have plexiglass and those things will be taken care of, but high touch areas that will be disinfected 3 times a day. Our common area furniture has been distanced and wiped down daily, will be wiped down daily. Any area where students interact with staff are cleaned during the regular staff member shift change. Students, when it comes to your res hall room, please know that we expect you to take care of cleaning your own bedroom, your suite apartment bathroom, as well as any kitchen if that is in your space. Some cleaning resources may be available on a limited basis. However, we encourage students to start purchasing cleaning supplies that adhere to the CDC guidelines. And lastly, for guests, I know this has come up quite a bit, so we want to let you know we're still developing our process related to guests and the specific policies, but we will be restricting guests in our residence halls and more so in the month of September, but guests will be allowed for move-in as we recognize that students and their families will want to assist in that process. So thank you, and I will now turn it over to Kay Eilers, Interim Co-Lead for Enrollment Management.
Thank you, Arcetta, and good morning, everyone. Of course, we are not just experiencing COVID, we're also dealing with the ongoing racial injustice, as well as economic and political unease that indeed have some significant impacts on our students and our overall campus community. So with that, we've had a couple of really thoughtful questions that have come in that I have the pleasure of addressing. One is in regards to what sort of supports UWM is putting in place to best support our underrepresented students. We have a number of offices on campus that are specifically designed to support underrepresented students, both individually and in terms of community building. We also have a number of different excellent resources on campus that we're pushing students towards so that they can get the resources that they need, be it financial, technology, personal support, and so forth. So that's really a focus for students, particularly because we know the shifts of the class formats and so forth have been really stressful for students in terms of the feedback they've given us in surveys, as well as specifically to staff members. The other really thoughtful question that came up, and Kelly addressed briefly in her opening statements as well, is what is UWM doing in terms of safety training and supporting students' right to speak up, considering we're in an election year and the ongoing Black Lives Matter movement. So we want to ensure that freedom of expression continues to be a bedrock principle here at UWM, and we recognize and encourage students' right to gather and share their views. So of course, we will want to follow all of the health guidelines that are necessary for any formal program. So space might be limited and will require some social distancing. We'll also be supporting students to make sure that they're aware of what needs to exist to gather safely and express express their views safely. So that is an ongoing conversation, more to come in that space. So with that, I'll turn it back over to Chancellor Mone.
Well, thank you, Kay, Arcetta, and Kelly. I think you answered another 27 questions around very important details that we will, as a reminder, be putting on our website as part of the FAQs. All the questions that will be submitted will have answers. And now we'll be introducing our campus health officer, Dr. Julie Bonner, who will be speaking about masks, testing, and physical distancing. Julie.
Thank you, Chancellor Mone. What I really can see in terms of the conversation that we've already had today, and I hope you can as well, how the foundational principles of health and safety and well-being of our students and our employees are really central themes within all of our planning. In terms of masks, as well as social distancing, those two aspects are particularly important as they have some of the strongest evidence related to helping our community reduce the transmission of COVID-19. For today, as I'm in one of our private offices, which is one of our exceptions related to wearing masks, and because I want you to be able to see me directly as I communicate over the course of the rest of my section, I'll remove my mask. In terms of health and safety and our planning, we have been very fortunate to be able to work with a team of health and public health professionals. These include 4 health departments. Those are the 3 health departments where our facilities are located, as well as our neighboring health department, our North Shore Health Department. We also have been working with the State Health Department, and we have been working with our Regional Healthcare Emergency Readiness Coalition, UW System, and the Plan Ahead teams. Because with the evolving guidance, which was language that I used back in January in some of my first communications, it really takes a team of individuals that are working diligently every day to interpret new guidance and move us forward in terms of being able to open safely for our community members. I wanted to touch on a few key points. We received a lot of questions in this area, and I do want to encourage individuals to read the Emergency Operations Center plan, which, while lengthy, has a lot of details and really talks about a coordinated effort, because it's not going to be just one single solution that we have here in terms of reducing the transmission within our community, but it is going to require all of us working together and require us to follow not just masks and social distancing, but also being sure that if someone is ill, that they're staying at home, and that, again, we're working together as a community in terms of it being the best effort possible as a team and as a group. So I want to dive into a concept related to, are we prepared related to when there are positive cases in one of our community members, whether that's a student and an employee. And we are very well prepared. We've had a longstanding relationship with the City Milwaukee Health Department for the 15 years that I've been here. And we work closely with them with infectious disease management. This includes if there is a classroom impacted, if there is a household in one of our residence halls impacted, or whether that's an office impacted. And we will continue to coordinate with them and our other local health departments related to being action-oriented while maintaining confidentiality and deploying our response teams related to cleaning and disinfection and communicating with the public health department to those that are close contacts. Another topic where we received a lot of questions is related to testing in our community. And currently, the CDC, local, and state health officials that I mentioned a little earlier do not include plans related to widespread testing in higher education settings. Some of you, many of you likely, because many individuals had anxiously also been awaiting for the K through 12 guidelines in our state, can see that as we're working towards solutions, one of the solutions that is also not included there is widespread testing within the community. Moving on to testing plans that we do have, through the Norris Health Center, we have been actively taking care of our students. We've been taking care of their emotional well-being remotely through our mental health services, as well as our on-site medical services are active. And we provide testing to students through our testing tent, as well as through telehealth services. One or two other points that have come up in questions. We will continue to work with the health department as we have with the vaccine clinic that we had in February and H1N1 in terms of opportunities to bring testing and vaccines on site to campus in the fall. With that, I'm going to turn it over to Melissa Spadenuta to cover a few additional points on this really important topic.
Thank you, Julie, and good morning to everyone who's online today. I'm going to cover a few topics related to employee health and safety. UWM does not have on-site health services for faculty and staff, so we offer a variety of health and safety resources through various departments on campus, such as human resources and university safety and assurances. Currently, COVID-19 testing is available in the community for symptomatic people, so employees should be tested through their primary care physicians or community testing sites. Moving on to a topic about how are we handling safety for employees that are on site. So although most of our faculty and staff were transitioned to work remotely this spring, there still were employees that remained on site to complete essential services, such as our police department, Norris Health Center, as well as many of our facility services staff. So since April, employees that have been working on site are required to read and acknowledge the essential on-site employee work practices. This guidance provides safety procedures, expectations for self-monitoring of COVID-19 symptoms, and processes for handling on-site symptomatic employees. Employees are expected to self-monitor for the symptoms each day before they come on site. This does include temperature monitoring to verify that they do not have a fever. If anyone has symptoms consistent with COVID-19, they are not supposed to be coming to the workplace. And at this time, we are not planning for the use of no contact thermometers on site because we are using the self-monitoring process. The EEOC has a testing, tracking, and monitoring group. This group is evaluating options for daily recording of symptom monitoring for employees, as well as options that we may be able to implement for students. In addition, training and other guidance for students and employees related to on-site safety protocols, health risks, and COVID-19 are under development and will be updated as changes occur in this dynamic environment quite frequently. So I will now transition back to the Chancellor for the next topic.
Great job, Melissa and Julie. These are important technical details that a lot of questions have come in around, so great job. I now will introduce Vice Chancellor Robin Van Harpen, who's going to be talking about facilities, parking and transportation, and working from home. Robin, please take it away.
Good morning. Great. We will try to work through these three topics as quickly as possible. And for the first two, facilities and parking and transportation, Melissa Spadenuta, who you just saw, is going to continue to join me. I just want to note that Melissa is our new Associate Vice Chancellor for Facilities Planning and Management. She went through a recruitment process before we went offline and started her job at the beginning of June. So it's been a very busy job, but very fortuitously for us, she is a expert in microbiology and health and safety, so it's really perfect timing for her to come into this role. Our first topic is related to facilities, and this is something that is covered in detail in our Emergency Operations Center report, which is published online. I do want to give a shout out to all of the staff that were involved in creating that report, led by Julie Bonner and Chief Lemire, and who are now moving into the implementation phase of that report. One unit on campus, the Speech and Language Clinic, asked specifically about whether there would be a reopening team available to help with reopening procedures, and they indicated that their needs are unique. This is a question that we've been hearing a lot of areas ask, so it's a very good question. The building preparedness and operations subteam of the EOC is now beginning to actually work through implementation of reopening plans, building by building. They'll be working with department chairs and building chairs in those buildings. They're starting with several research-intensive buildings and using those as a pilot. And once they work through those, then they'll be able to scale up that process more en masse. Research and student-facing services are the highest priority and the first to go back online. So they're starting with those areas, and then they will work their way to other areas, and they will contact those areas when they're ready. In the meantime, we are telling departments that it is useful if they begin planning their on-site staffing plans, taking into account the department's functions, as well as their space and opportunities for social distancing in that space, and their optimal timing in order to be prepared for coming back online in the fall. Once departments have those plans and are ready with those, then when the building preparedness team contacts them, they will be ready to work through that reopening process. We also received a question about whether additional resources or employees are being provided to help address safety, cleaning, and other needs through the reopening process. And I would say that the answer to that question is yes and no. We have set aside a fairly generous central fund that is helping to pay for new COVID-related expenses and has been even in the spring. So at least for the fall, we are paying centrally for all personal protective equipment, all the signage and building modifications that are needed, as well as additional critical needs that have risen during the planning process. At the same time, this COVID situation has created the most significant financial crisis and loss of revenues that we have ever seen at UWM over a one-year period. So with that in mind, we do need to continue to be very judicious about our spending in general. We are spending into balances at this time in order to prepare for the reopening. The Chancellor is in the process of preparing a budget update that will be sent to the campus next week. We have had a financial impact and modeling team that's been working on the financial scenario planning, and more details on that will be sent to the campus next week. I'm now going to turn it over to Melissa, who will add some additional comments on facilities.
Thanks, Robin. In terms of cleaning, we are prioritizing high impact areas such as classrooms, bathrooms, and other common touch points, door handles, railings, other items like that. Cleaning products and disinfectants will be provided for occupant use in classrooms and offices. This will support the environmental services staff in their cleaning, and it allows people to clean their own personal space before and after use. There were a few questions that came in related to ventilation in UWM buildings, including windowless lecture halls, restrooms, and windows that don't open. So a little bit of background on UWM HVAC systems. We do bring in outside air through the air handling system, which then is filtered, and the temperature is adjusted through heating or cooling to a temperature that's appropriate for the occupied space. Air is recirculated in the buildings. When it's recirculated, it also passes through filters again and is mixed in with outside air. So we are following state specifications, International Mechanical Code, to make sure that the indoor air quality is optimal. It's important to note that the virus that causes COVID-19 is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets settle out of the air quickly, so spread is most likely to happen when two people are in close contact with one another. And this is again why we are focusing on the safety items such as social distancing, making sure we're wearing face masks, and also cleaning our spaces again before and after use. All of these things can reduce the risk of disease transmission. With that in mind, we are not planning on any significant modifications to our HVAC systems. This is consistent with other UW institutions, including Madison. We are continuing our preventative maintenance. Like I mentioned before, facility services staff are on site. They've been on site this entire time, and they actually are slightly enjoying that they can get their work done a little easier with fewer people on campus. But all of the work with our HVAC is continuing. If you do have a specific area that you feel is a problem, please reach out to your building chair or out to the Facility Services Help Desk so a specific area can be assessed. I'll pass it back to Robin for the next topic.
Great, thank you. Thank you, Melissa. We're now going to answer a few questions about parking and transportation. So to kick off this topic, I would just note that Transportation Services has submitted an updated FAQ pertaining to transportation and parking issues. And I just checked this morning. I see it's not up online yet. It's going through the approval process, but you should see that online and available pretty shortly. In the meantime, what's included in that FAQ is that BOSS, UPark, and the Residence Hall shuttles will all be running in the fall with safety protocol in place, including cleaning before each shift, deep cleaning once a day, required face masks, and social distancing. Transportation Services also will start to charge for parking beginning July 13th with discounted parking rates. Transportation Services does have expenses as well, and we do need to start charging for parking. But in recognition of the fact that there will be more part-time workers in the fall than usual, they are in the process of creating additional options for parkers, particularly those who want to park on a part-time basis, including daily parking passes at discounted prices in a number of locations, with an emphasis on contactless parking. I'm now going to pass it over to Melissa for a few additional comments on parking and transportation.
Thanks, Robin. A question came in related to the Milwaukee County Transit System and their services, including the 10-passenger limit and how that might be impacting our faculty and staff. At this time, Transportation Services is waiting on a current contract with MCTS. As you can imagine, MCTS has experienced quite a few changes. So this transition to how things might happen in the fall and upcoming year is difficult for them as well. So as soon as Transportation Services receives information and a contract, they will be sure to share that with the campus and faculty and staff. We do expect less demand for MCTS services with the smaller percentage of face-to-face instruction and reduced numbers of employees working on site. To address the potential impact of this change for our faculty and staff, Transportation Services is planning to offer discounted parking options that Robin mentioned, but specifically a hunting permit will cost $33 a month, which is the same cost as a monthly bus pass last year for our employees. Other options are also going to be available, such as discounted daily permits, if that should be most cost effective for our faculty and staff. Another employee asked about travel between campuses, if that's part of their regular duties. So if you're an employee that has to go between the campus and School of Freshwater Sciences or another building, what happens? So if the employee must be approved to be working on site, and if they are, any travel between those buildings that they use their own vehicle for, they may continue to be eligible for reimbursement as they were prior to COVID-19. I'll now pass it back to Robin for the next topic.
Thank you, Melissa. So our final topic is working from home. And our Associate Vice Chancellor for Human Resources, Tim Danielson, is going to be joining me to help answer a few specific questions in this area. I will say this is another topic that's covered in extensive detail in our Emergency Operations Center report published online. I just wanted to offer a few comments before I turn it over to Tim for some specific questions. Again, as I noted just when we were talking about the facilities section, we do have a building preparedness working group working through building by building to ensure that buildings are prepared for employees to come back to work on campus. At the same time, departments are being asked to prepare their on-site working plans, including what staffing will look like in the fall, again, considering the specific functions of that area and how they serve students in the campus and the office spaces and available social distancing. We do want to note an important principle, which is that where employees can continue to effectively work from home, that is welcomed and will be helpful in order to actually reduce the numbers of individuals on campus and the density of people in the common areas and corridors. I'm now going to pass it over to Tim Danielson to answer some of our specific questions.
Thank you, Robin. I'm going to be brief. In the instances where an employee desires to work remotely, if the supervisor, department head, and/or division head agrees that the work can be completed effectively remotely and the essential in-service or in-person services that the department needs to execute can be accomplished, it is okay for the employee to work remotely. Now, for questions about working on-site or working remotely beyond this that deal with things like conflicts between an employee's needs and the employee's responsibilities, questions about employees who live with a person who may be immunocompromised and what options may be available to them, desires that an employee may have post July 31st to work on-site full-time because their circumstances are such that they know they would be more effective if they could work on-site full-time. Or any other questions that come up that are related to this topic, I would ask employees to speak with their department head or supervisor, and employees, department heads, supervisors, division heads. Please engage the HR business partner or prep who works with your respective division. They will guide you through whatever options may be available, including potential accommodations under the ADA or the Family Medical Leave Act. Those are my comments. Chancellor Mone, I'll pass it back to you.
Thank you, Tim, Melissa, Robin. I think we may not be at quite 100 questions answered across all of these, but we're getting pretty close. A lot of great, important technical information. As a reminder to everybody, all our questions will be answered both in this town hall and through the FAQs that will be posted. We now move to the Q&A portion, and this is the live section. And the first question that has come in deals with how will we enforce the use of face masks on campus? I'll start with that and then ask Vice Chancellor Robin Van Harpen to follow up. First, we will be issuing, and as you can imagine, we're talking right now about an explicit requirement that face masks be worn on campus, in particular inside all of our buildings. We want that to be something that we all communicate, including all of you listening from faculty and staff perspectives, for us to make sure we model that. Those are going to be very important for us to create a culture of safety and health. We think this is just so foundational given what we know from CDC and other public health authorities. We also will be engaging in a social media campaign to reinforce that culture. I want you to know that at this point, there is no official sanction that we plan to impose. In fact, the legislature right now is asking about that specifically yesterday. And so some UW system representatives will probably be talking to the legislature about this. We are also talking about having a Board of Regents resolution in support of this. We don't know if that will go forward or not, but the regents have expressed a lot of support for that. So those are some of the initial thoughts on the requirements to be enforced around face masks. Robin, do you have anything you'd like to add, please?
I would just add that along with the social media campaign, we also are working on extensive signage to continue to remind people about the masks. But I will say the more that all of our employees begin to model this behavior, the more that we'll be able to encourage students to do that as well.
Great, thank you, Robin. Our next question, I'm going to scroll back up to my questions that are coming in. This is for Kay Eilers, and it's anonymous. Will classes still be offered to senior auditors?
Thanks, that's a great question. Yes, classes will still be offered to our senior auditors. We do anticipate that most of our senior auditors will be taking online courses as they tend to enroll in the largest lecture classes that will likely be delivered online.
Great, thank you, Kay. Our next question is for Robin. It's from Anonymous. Bundled into one question, there's actually a series of sub-questions. Can we get an update on plans for the second round of the pay plan due to take effect January 2021? When will employees get the 2020 raise that was in the state budget?
Great. I see 2 dates mentioned in that question. So just a reminder that this biennial pay plan provided for 2 phases to the increase in pay, one that took effect already in January of 2020, and one that is scheduled to take effect in January of 2021. The raise that went into effect in January 2020 has been implemented and will not be revoked in any way. If you might have heard something to this effect, the governor did provide a lapse for the funding to institutions that would have paid for that in fiscal year 2020. So that effectively is a budget cut back to UWM, but it does not actually impact those raises that went into effect in January. For the upcoming increment that's to take place in January 2021, we have not, there's been no action to remove that or to revoke that from employees. So we're still planning on implementing that. That is a statewide pay plan, and so we would implement that. However, the legislature would have the power to revoke that if they saw fit. We have been told by UW System to plan around a 5 to 15% state budget cut in the upcoming year, just to be conservative and to be looking forward, but there have been no specifics around that developed at this time.
Thank you, Robin. The next question deals with, this is from Jennifer Jordan in sociology, and it looks like for me and our Chief Health Officer, Dr. Bonner, will campus be tracking and publicizing COVID cases? Many universities are, including Texas Christian University. I'll offer a couple of thoughts on that. First, this is a matter that is subject to guidance and requirements from our local public health authorities. And I think you know that when we've had cases where we've had positive individuals in the community and on campuses, the public health authorities take that over. This is beyond our jurisdiction. As far as the tracking, they're involved with that, and that's really been their purview. The publicity of it, because of HIPAA and other privacy concerns, I don't think we would probably have the jurisdiction to be announcing and talking about that, but that's something that we are still working on, and of course that's another example of where things evolve. So at this point, I would ask if Dr. Bonner has any additional comments or perspectives on this.
Thanks, Chancellor Mone. There are a few comments that I would add on that, and I agree with your statements. We will be tracking, as you can see on the on-site employee guidance, we will certainly be tracking individuals who are positive in order to be able to do our localized response. We also, with students, are creating systems to be able to do that as well. In terms of the publishing of that, I am aware and have seen some universities that have provided some general information, and we will be, again, focused on the confidentiality, following our legal obligations, as well as working with our public health officials. It allows me to reference that we have some excellent tracking and dashboards that the City of Milwaukee, the County of Milwaukee, Waukesha County, and Washington County, along with the state, are providing as well, broken down by age groups, gender, race, and ethnicity. And so I would definitely encourage individuals to look towards that as well in terms of being aware of what's going on in our community. Thank you.
Thanks, Julie. Our next question is from Amanda Keys in the Office of Undergraduate Admissions. Legionella bacteria, which can lead to Legionnaire's disease, proliferates in stagnant water. Will UWM be flushing the water lines before reopening for the fall? I would ask Melissa to answer that question, please.
So as I had mentioned earlier, our facility services staff have been on site and they have been maintaining our buildings and all of our facilities just as they would have if we were fully occupied. So they are ensuring that water is moving through the pipes and through all of our fixtures on a regular basis, just to make sure that everything is safe and in good working order. So this concern should hopefully be addressed through that process. Thanks.
Thank you, Melissa. Thank you, Melissa. Our next question is for Johannes, and it's from Anna Manson McGinty in Women and Gender Studies. There's a significant amount of labor that goes into reworking a face-to-face course to online format. Are there any serious discussions about offering financial compensation for this extra work for instructors who are not on contract during the summer, especially for grad student instructors and lecturers?
Thank you very much. Good morning, Anna. Thank you for your question as well. It's of course not a very easy answer, simply because we are not, at this point looking to financial compensation for the work. And I would like to also follow up with the specific deans on that question that you asked me for our graduate students who are involved in teaching, Anna. And also looking at, how can we do some of the training also through the spring semester in planning for the fall. But we're not at this point, based on the situation that we face, looked at, as you mentioned here, a serious discussion about the financial compensation for the additional work. And my point is just again, thank you for everybody for the work that you've done up to this point in helping us getting through this big crisis. Thank you, Chancellor Mone.
Thank you, Provost Britz. So the next one is also for you, and Dean Grunner from Anonymous. Could a general timeline for the progression through the stages of research reopening be provided? When is it anticipated to move to stage 2, stage 3?
Okay, I can give a little background on that. We are moving into stage 2 right now. The plans are being submitted by principal investigators with respect to how they will operate their labs safely. Just like the issues with capacity in classrooms, we have issues with safe capacity within the lab. So we are moving right now into stage 2. Stage 3, I can't really give any guidance on that. That's tied into, again, the progression of the virus in the area. That's more a question for Mark Harris. I can't really go into too many details, but right now we're going to stage 2, which will have about 25% of our capacity in the research labs. And while I'm here, I just also make a correction to something I said a little earlier, that in terms of the schedule of classes, we'll have the face-to-face online mid-July. It'll be early August when we have the final classroom assignments done. I'll turn that back now to Chancellor Mone.
Great. Thank you, Dean Grunner. Our next question is for Tim Danielson and Robin Van Harpen from Christopher Cantwell in History. If local school districts chose to move forward with plans that involve remote learning for children, this will place a burden on faculty and staff who care for school-aged children, as they will now have to provide added childcare. How will the university account for this added burden in assessing the productivity of faculty and staff for the purposes of promotion and tenure?
Thank you, Chancellor. Regarding childcare, and I'm going to add elder care actually to the question as well, they're both mentioned in the campus EOC report, and there are additional accommodations provided to employees throughout the United States by an expansion of the Federal Family Medical Leave Act. And so for individuals, employees in all employee categories of the institution who are potentially facing child or elder care issues, this would be a great example of an opportunity to speak with the HR business partner or prep that works with your school, college, or division. They can guide you through the process of either requesting accommodation or explaining any options that may exist for you. Regarding the component of tenure and promotion, that is something I would ask either Provost Britz or Dean Roner to entertain, please.
Yes, Scott or Hannes, please.
Thank you very much, Tim and Chancellor. Yes, we will actually, and Kathy is also on the panel as well, Kathy Dolan. We actually did build in a process for faculty in terms of their promotion and tenure to actually submit a request to my office that I will then actually discuss on an individual case with the university committee. So we have built that in the process, but it will be again based on every specific situation of faculty being impacted by the COVID-19. Thank you, Chancellor Mone.
Great, thank you, Provost Britz. In the interest of time, we're now at 10 o'clock. What I'd like to do is just wrap up with a couple of closing comments. I first want to thank all of you as participants in today's town hall. Know that more will be coming. I also want to thank all of our panelists for all the information that you've provided. I think we've done a good job getting through a lot of the questions. And I want you to know that we've shared a lot of information about what we know. We're continuing to work through many issues, and more answers and more information will be forthcoming. We, again, as I've said many times, we will be answering all of the questions in our FAQ, so you can look forward to having those that we'll be following up in the next several days. There will be more town halls to come, both for our faculty and staff, as well as for our students and their family members, as we have been doing through this summer already. The world that we're in and the COVID planning is incredibly dynamic. It's also very challenging, very complicated. There's no playbook. We're creating it as we go. But as much as we know how difficult this will be, we're also, as a campus, with respect to our mission around education, research, and engaging the community, we're simply too important not to persevere, not to continue to put everything we have into the work that we're doing. So again, thank you. I know that we will continue to press ahead, and we're going to be successful in any particular modality that we will be delivering this fall. Thank you again, and have a good rest of your week and weekend. Bye.